Welcome back. From giving vaccinations to delivering babies, they're on the front lines of health care. The U.S. has more than 3 million nurses, and with more people getting health insurance under the new law, they're in higher demand, and the roles of nurses are also changing. Here was some insight this morning as nursing expert Yvonne VanDyke with Seton Healthcare family. Thank you so much for being here.
Good morning.
Good morning to you. We have been reporting on the shortage of nurses for a while now. Is it getting any better?
Actually, Erin, it is. More individuals are entering the profession, but because, as you said, more folks will be eligible for health care, the demand will continue. So it will continue to be a high-demand profession.
We just mentioned that the role is changing. How is it changing and why?
Because more people are eligible for health care and consumers and payers are demanding that health care is more convenient, that it is of greater value, that patients are focused more on health and wellness. Nurses now are involved in helping patients to become more focused on wellness and where health care will be delivered in order to respond to the demands for convenience. So nurses are now involved in providing care in integrated health care systems in the community and doctor's office in ways that they haven't in the past.
When these nurses are coming out of school, do they need a new set of skills? They need to bring some new tools to the table.
Actually, that's true. Because of the transition of health care from the hospitals into the community, nurses now need to have skills in community-based health, population health management. They need to have better leadership skills and really strong collaboration and team-based skills that we haven't had to rely on so much when healthcare was so focused in hospitals.
And I'm sure this plays into it a little bit, but you and Seton are behind a push to have all of your nurses get a Bachelor of Science degree.
Yes, that's correct. We have such outstanding nurses at Seton. They've been educated at all levels of nursing, but again, with the transition of health care away from the hospitals into the community, we are encouraging our nurses and supporting them to acquire a minimum of a bachelor's degree. Our nurses have stepped up. They are continuing their education, and the reason for this is, again, so that the additional skills that can be incorporated in a longer program, like a bachelor's degree program, affords them the competencies and skills they need in leadership and interprofessional interaction and coordination of care for populations in the community.
Got it. Last but not least, we've got about 20 seconds left, but Seton has a way for these nurses to get hands-on training on site.
Absolutely. At our Clinical Education Center, it is an interprofessional clinical education center equipped with high-fidelity mannequins, and in that environment we bring together nurses, physicians, pharmacists, and a whole host of healthcare professionals so they learn to work together in a simulated environment, and they're much more comfortable delivering care either in our hospitals or in the community as team members.
All right, Yvonne, thank you very much. Some very good information this morning. We'll have all of this on our website. If you missed anything, thank you so much.
Thank you.